Welcome to Review Central. This is NCLEX Reviewer No. 5, featuring questions on physiological adaptation. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Now let's begin. Question number 1. Which of the following markers is most specific for acute myocardial infarction? A. Troponin. B. Myoglobin. C. Creatine kinase. D. Lactate dehydrogenase. The correct answer is A. Troponin. Troponin is specific for myocardial infarction and will remain elevated for up to a week. Creatine kinase is found in all muscles and will return to normal about 3 days after myocardial infarction. Myoglobin is found in all muscles but returns to normal the fastest after myocardial infarction. Question number 2. What is the best treatment for a 46-year-old who has atrial fibrillation that started 24 hours ago? A. Cardioversion. B. Amiodarone. C. Pacemaker. D. Digoxin. The correct answer is A. Cardioversion. Elective cardioversion is ideal for patients who have acute atrial fibrillation. Patients who have had atrial fibrillation for less than 48 hours respond best to cardioversion. However, all patients who undergo cardioversion must be properly anticoagulated. Administer heparin, or low molecular weight heparin, before cardioversion. Question number 3. What is the mortality of serotonin syndrome? A. 1 to 15%. B. 15 to 25%. C. 25 to 40%. D. 40 to 50%. The correct answer is A. 1 to 15%. Mortality rates for serotonin syndrome are dependent on the time it takes to arrive at the hospital and appropriate care. Exact figures are difficult to determine as there are many drugs that can be involved. One study showed a mortality rate of 11%. Serotonin syndrome occurs following use of serotonergic drugs. The degree of symptoms can range from mild to severe. Symptoms include hyperthermia, agitation, increased reflexes, tremor, sweating, dilated pupils, and diarrhea. Temperature can increase to greater than 41.1 degrees Celsius or 106.0 degrees Fahrenheit. Complications include seizures and extensive muscle breakdown. Serotonin syndrome is typically caused by selective serotonin reuptake inhibitor, serotonin norepinephrine reuptake inhibitor, monoamine oxidase inhibitor, tricyclic antidepressants, amphetamines, meperidine, tramadol, dextromethorphan, buspirone, L-tryptophan, 5-HTP, St. John's wort, triptans, ecstasy, metoclopramide, ondansetron, or cocaine. Serotonin syndrome is found in 15% of SSRI overdoses. It is a predictable consequence of excess serotonin. The onset of symptoms occurs within a day of the extra serotonin. Treatment consists of stopping the serotonin. In those who are agitated, benzodiazepines and a serotonin antagonist such as cyproheptadine may be used. In those with hyperthermia, active cooling measures may be needed. With treatment, the risk of death is less than 1%. The high-profile case of Libby Zion, who is thought to have died of undiagnosed serotonin syndrome, led to reduced work hours graduate medical education. Question number 4. Where is the most common site for Staphylococcus infection to develop in a bone marrow transplant patient? A. In the eyes. B. In the bone marrow. C. Central venous catheter site. D. In the GI tract manifesting as diarrhea. The correct answer is C. Central venous catheter site. Staph infections are the most common bacterial source of infection, occurring most often in central lines. Question number 5. A G3P2 female is receiving epidural anesthesia and is in active labor following oxytocin augmentation. Decelerations of the fetal heart rate are to the 70s for 3 minutes. The fetus is reactive. The patient's blood pressure is 90/40ths of a millimeter of mercury. What is the most likely cause of the decelerations? A. Uterine hyperstimulation. B. Epidural analgesia. C. Cord prolapse. D. Oxytocin. The correct answer is B. Epidural analgesia. Both the hypotension and decreased placental perfusion can be corrected with oxygen, IV fluids, ephedrine, and turning the patient on her left side. The patient should be turned to her left side to decrease uterine pressure on the great vessels. Oxytocin should be stopped because hyperstimulation of the uterus can be a cause of fetal hypoxia. Question number 6. A patient underwent subtotal thyroidectomy. How long will she need thyroid replacement therapy? A. Until thyroid gland regenerates. B. 12 months. C. 5 years. D. Lifetime. The correct answer is D. Lifetime. Thyroid replacement therapy is usually a lifetime treatment. Medication is given once in the morning. Question number 7. What physical exam finding is consistent with a diaphragmatic hernia? A. Stridor. B. E to A changes. C. Expiratory wheezing. D. Unilateral diminished breath sounds with peristaltic sounds. The correct answer is D. Unilateral diminished breath sounds with peristaltic sounds. Unilateral diminished breath sounds with peristaltic sounds are indicative of a diaphragmatic hernia. Asthma can present with expiratory wheezing. E to A changes are termed egophony and indicate lung consolidation. Stridor can represent epiglottitis or croup. Question number 8. During pregnancy, what is the amount of iron required? A. 1 mg per day. B. 2 mg per day. C. 3 mg per day. D. 4 mg per day. The correct answer is D. Average iron requirement during pregnancy is 4 mg per day. The relatively high requirement for iron is because most pregnant women have microcytic anemia. Question number 9. What is the biological molecule to which low molecular weight heparins or LMWH directly bind? A. Thrombin. B. Plasminogen. C. Antithrombin 3. D. Factor proteases. The correct answer is C. Antithrombin 3. Enoxaparin is a typical low molecular weight heparin, or LMWH. LMWHs are indirect thrombin inhibitors that bind directly to antithrombin 3 or AT. Binding to antithrombin results in a conformational change that allows antithrombin to bind, and inactivate, the clotting factor proteases, also known as XA. LMWHs dissociate intact after the antithrombin protease complex is formed. The effect is inhibition of factor XA, but it is mediated by binding to and activating antithrombin. Other LMWH-like products include dalteparin and danaparoid. The major toxicity with these agents is bleeding. Question number 10. What is the most common risk factor for urinary tract infection in females? A. Heavy menstruation. B. Urinary stasis. C. Condom use. D. Sexual intercourse. The correct answer is B. Urinary stasis. Urinary stasis is the most common risk factor for urinary tract infection in females. Sexual intercourse, condom use, and heavy menstruation are much less likely risk factors. A good, clean, urinalysis specimen is vital to the workup of a possible urinary tract infection. A clean catched specimen in non-obese females is preferred. Most obese females cannot give a clean specimen, and epithelial cells in the urinalysis mean the urine sample was exposed to the genital surface and did not come directly out of the urethra. Antibiotics used to treat urinary tract infection include trimethoprim/sulfamethoxazole, nitrofurantoin, first-generation cephalosporins, and fluoroquinolones. You have just completed NCLEX Reviewer No. 5, which featured questions on physiological adaptation. If you wish to watch more NCLEX reviewers on physiological adaptation, check out our NCLEX Physiological Adaptation Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central, and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX.